If I were to hand you a model of somebody's mouth and ask you to look at it, would you hold it in your hand or would you manipulate it and flip it and turn it and look in all views of space? Well, this is the same for radiographs. Why look at a flat image when you can have the technology to actually manipulate an image in your hands? Well, this is the same question that the orthodontic community is asking themselves. This is also why 3D cone beam computerized tomography is affecting and changing the orthodontic community. Hi, my name is Laura Wright, and I've been a part of the orthodontic community for the past 11 years, and I work directly with orthodontists and other specialties who utilize CBCT, or cone beam computerized tomography, in their daily practice. CBCT is significantly changing the orthodontic community because it affects the way you can diagnose and treat your patients. Today we will explore the 3 top benefits to using that 3D technology. The first one being the ability to look at the oral facial structures in those 3 planes of space and be able to manipulate it in your hands, essentially. The other thing that we will look at today is the ability to have more information for less radiation, which is always important to a patient's health, parent concerns while they're undergoing orthodontic treatment. And the third thing we'll look at today is having unique treatment plans based on that patient's unique anatomy. We're all different, so our treatment plans for orthodontics should all be different as well. So to begin, let's talk about the advantages of using 3D technology to look at the oral facial structures of a patient. Now, according to the Department of Orthodontics at the University of Mississippi, Dr. Abel Karim, he states that CBCT has the capability of evaluating teeth and adjacent tooth structures more accurately than 2D imaging. Now, 2D imaging is currently the standard of care for all orthodontic practices. However, orthodontists are seeing the change in the availability of CBCT and how it allows them to evaluate the patient's bone, airways, how the top and bottom jaws relate to one another, and also just supporting structures. If patients have teeth that are stuck or teeth that need to come out, we're available to see all of those structures with the 3D. CBCT also allows a clear view of the structures with less radiation to the patient. So let's discuss that, radiation. So in my office personally, we like to say the term, we get more information for less radiation. And that is very true when it comes to the true effect of radiation. Those flat 2D panoramic x-rays, they have about 34.9 microsieverts, and that's according to the ADA. Whereas a CBCT, that 3D image, for roughly a comparison scan, only has about 11 microsieverts, and that's per the ADA as well. CBCTs provide the advantage of choosing your field of view. So if you want to look at the patient's entire head, neck up, you have a collimation to choose from. You can do that, or you can do a small down to just one area of the mouth or even just one single tooth. Having that availability for a patient, we can really get a good treatment plan unique to their own anatomy. So that leads us to individualized treatment plans because of these 3D imaging scans. Dr. Melissa Shotwell states utilizing this technology, CBCT, can lead to complete and unique treatment plans for a patient. Now, treatment planning with CBCT allows the provider to look at all aspects of the patient's dental health. So being able to do that, we know if the patient needs extractions or they need jaw surgery or they need some bone grafting, all of those play a role in the patient's treatment plan. Being able to do a treatment plan based on anatomy and not the analysis of a textbook is really fueling the orthodontic community and that specialty. So in conclusion, CBCT is allowing the orthodontic specialty to advance in ways with diagnosing and treating their patients. It also provides less radiation for more information, and you're getting the better of the two. This should be the standard of care. So even though CBCT is not the standard of care, the advantages of this technology are quickly catching on and soon will change the entire orthodontic community, and it'll also change the standard of care for all patients. I appreciate your time today, and I hope you enjoyed this lecture. Have a great day.